And Justin Timberlake is in the news today. His announcement that he has been recently diagnosed with Lyme disease has put a spotlight on the impairing infection. In an Instagram post, Timberlake said that living with the bacterial infection can be, and I'm quoting here his words, relentlessly debilitating both mentally and physically. He said at one point he actually had to decide whether or not he could continue performing. But he said he was glad that he kept on going and going and going. Dr. Todd Elner is with us right now. Familiar face here at News Center 5. Great to see you. Happy Friday.
Good to see you, Eddie.
So let's talk about that. Of course, it's named for Lyme, Connecticut, in Massachusetts, right in a neighboring state with Connecticut. It's been at the epicenter for tick-borne illnesses for a long time. 2023, we ranked third among the states with the most cases of Lyme disease. Do you have any idea how many you have diagnosed?
Wow, over the years, remember I've been doing this for over 20 years. South Shore Health, we're at the epicenter, right? And so thousands of cases, we've seen this. And you know, our providers are really experienced at diagnosing and treating Lyme disease, but it can present in many different fashions. So it's still challenging, even today.
Still challenging today. Timberlake said in an Instagram post that he experienced, and again I'm quoting him, a massive amount of nerve pain and crazy fatigue before he was actually diagnosed. Is that a signal? Is that typical?
It can be, especially if things aren't diagnosed early. What's classic with Lyme disease, besides the rash that we think of and other things, is extreme debilitating fatigue. You can have nerve, muscle, or joint pain. So it can be, no two patients present the same way, but it can be very challenging. And these are some of the key features of it.
Really? No two patients present the same way. That is challenging. So do you think doctors here are more likely to catch it earlier? Because, you know, as you mentioned, you see it so often.
We see it a lot. Again, I think our providers are excellent at this. Many of them, our ED has seen so many of these patients, but the rash can still, even to this day, can be challenging. In fact, I have a picture, as you can see here, and people look for that bullseye. And sometimes even that rash, it's not a classic bullseye. Bullseyes are classic with a pale center, but here you can see where patients can be treated with antibiotics that don't necessarily treat the Lyme, and then it can progress to later stages. So I would say that it's important to treat it early, and when you treat early, though, patients do tend to do well.
So let's be clear. Justin Timberlake is not your patient, right?
Right.
Okay. So, but now that he's getting treated for Lyme disease, do you think it's likely he'll make a full recovery?
All right. So I'm going to first use my doctor hat
and
say that most patients recover completely, but there's a significant number of patients that go on and even after treatment have debilitating fatigue, brain fog, concentration difficulty, and that pain. And that can happen for months, sometimes years, okay? And that part of Lyme is very difficult for us to diagnose and treat. But now I'm gonna take my doctor's hat off. I'm gonna tell you I'm a huge JT fan.
Oh, you are?
So Eddie, if you are asking me if he is going to be bringing sexy back to a stage near you anytime soon, I say you're damn straight. Let's face it, he's a triple threat. Who else is as good of a singer, actor, and dancer as him?